Okay, it's early morning, kids just went off to school, and I am ready to get into the testimony for Dr. Vaskas, who is Alexee Trevizo's doctor at Artesia General. Now, before I get started, anybody who's followed me knows that if there's a mistake or an error, I'm okay to fix it. In my comments on the placental abruption video, there was a lot of nurses and a lot of people talking about the delivery of the placenta. And I don't know, maybe I'm the odd one because after 3 children and numerous people I know have had children, the placenta has never just come out that easily, not without some assistance, manipulation, stuff like that. However, as I've been informed by numerous people, that there are patients, and it is common, that 1 or 2 contractions right after birth, the placenta comes out. So for them, it does happen fairly easy and fairly quickly after birth. Obviously, at this point, without hearing this from Alexee, we're not going to know for 100% certainty that it came out at the same time. But after listening to some things with Dr. Vaskas, I still stand by the fact that she has a placental abruption. The amount of bleeding, the clots, all of that is included in this testimony. Now, this is probably going to be 2 to 3 parts because her testimony has a lot to it. She likes to ramble. She talks a lot. She gets questioned by the state. She gets questioned by Gary. And then she gets questioned by the judge because the judge also needs some clarity on what in the world, sorry, I got hair on me, what in the world she's talking about. There's a lot of confusion in her testimony. And what I'll do is I'll stop it in between and just kind of go over some stuff. But this is going to be the first section. Hopefully we get through it. This is basically her triage up until she starts examining her after she has the baby. Now, at the very beginning, you hear them talking about a bathroom incident. This is supposed to be the initial bathroom incident. So if you actually really pay attention and you listen to her entire testimony that I have up on YouTube, or that I will have up on YouTube, you're going to hear that she's talking about 2 different things here. She's talking about that while she's doing her initial exam, Alexee abruptly gets up and goes to the bathroom. Then she later kind of contradicts herself and says she doesn't realize that she is still in the bathroom after she gets all these tests back. But she says that while Alexee's in the bathroom, she goes to her desk and she orders the test. So there's no way she could order the test and the test come back and Alexee's still in the bathroom the entire time because they would have had to take her blood. So this leads me to believe and understand that there was some sort of initial bathroom incident and triage. Then she gets transferred into the room before the second bathroom incident occurs. Let's just get into it, listen to some of this, and I'll kind of go over it as we go along.
You said her chief complaint was for pain. Was she treated for that pain?
Well, she was evaluated, and I felt that she needed additional evaluation other than just a physical examination. So laboratory studies were ordered initially, as I believe, I don't have the record in front of me, so I cannot tell you at what time a CT scan was ordered, but I believe it was at the time of the initial evaluation.
Okay.
Well, she was complaining of very severe pain, and she would not allow me to physically examine her completely. So she was walking around the evaluation room, and I couldn't complete a abdominal examination. I was able to look at her back, but I couldn't complete the evaluation. And that seemed it was a little bit inconsistent with what you would normally expect, like a muscle strain. And so
I'm going to stop it there for a second because I need you guys to pay attention to what she just said. She discusses how she was not able to examine Alexee because Alexee was in a lot of pain. She was only able to kind of look at her back, but that was basically all she was able to do. This is very, very important because you're going to hear later a testimony where she contradicts this entire statement. So just pay attention to that part, that she could not examine or did not examine Alexee because Alexee was in so much pain.
That's correct.
Where'd she go?
She said she was going to the bathroom.
Okay. Did she say anything else about why she was exiting the exam room?
She did not, but at that time I asked the patient and her mother who had brought her if there was any chance she could be pregnant, and I cannot remember if the patient responded, but her mother said that categorically it was impossible, that she had been buying her pads every month, and she was certain she'd had periods every month. There was no way she could be pregnant.
Okay. She goes to the bathroom, and does there become an issue with her in the bathroom?
Well, So after she left to the bathroom, then I went back to my workstation and began entering orders as well as initiating my documentation. And I was not aware that she hadn't exited the bathroom until much a period later. It was after we received a positive pregnancy test, and we were waiting to get a further quantification of what we call basically it's a quantification of the pregnancy hormone level, because that was really critically important to me from a medical standpoint, because as soon as I realized that her pregnancy test was positive, another diagnostic possibility that's potentially life-threatening, specifically a ruptured ectopic pregnancy, becomes concerning. And so we really need that hormone level, like the actual numerical number, to evaluate how risky it is that a patient could potentially have a ruptured ectopic pregnancy, which is life-threatening. And so it was, I can't tell you the amount of time that it elapsed because I don't have access to the medical record right now. But at some point, as I was waiting for the final hormone level to become resulted, I asked where the patient was, and I was informed that she was still in the bathroom. And at that point, myself and the nurse went to the bathroom and I said, we need to get her out of there now. Because I was concerned that there could be a life-threatening emergency, and we needed to get her. We needed to call in an ultrasound tech because we don't have 24-hour ultrasound at the hospital. And so there were just things that needed to happen. And at that point, we couldn't get her to come out.
What do you mean by you couldn't get her to come
out? We knocked on the door and said, you need to come out. There was probably about a 15-minute period from when I said we need to get her out of the bathroom to when we got access to the bathroom. I had the toilet flushed several times. And so I kept thinking, okay, she's flushed the toilet, she's going to come out, and then she didn't. And when I heard the toilet flush a second time, I instructed staff to get keys to the bathroom and to forcibly get into the bathroom.
Okay, let's stop right there for a quick second. I did go ahead and put the overlay video so you guys can see she actually had zero concern for the patient until the end. And this was after she had already gotten the quantitative back. So now she knew exactly how pregnant Alexee was. And so she had already gotten that back. She goes and she tells them, hey, listen, where's she at? She's in the bathroom. The first time that she even steps into scene to ask about Alexee is 5 minutes before Alexee comes out. When it seems that she was trying to get Alexee out, only 2 to 3 minutes have passed. So 2 to 3 minutes versus 15 is a significant difference, especially when she was only in the bathroom for 19 minutes. That's like saying that the entire time she was in there, they were fighting with her to get her out. But in all reality, nobody bothered to check on her. Her mom checked on her twice, and Chris doesn't come in until the end. So she spent the bulk of that time in that bathroom with everybody knowing she was pregnant, knowing what was going on for the most part. Not that she was giving birth, but knowing that she was possibly having some complications of this pregnancy, and nobody bothered to check on her. Okay, I'm running out of time on this video. So when we go into the next part of her testimony, we're going to begin with the amount of blood, because she keeps talking about that over and over and over. She mentions how much blood there was. And this is really a key component, and I think it's going to be key in the trial, because when we're talking about an alternate theory or something that else could have happened and we start discussing the possible placental abruption, this is where all of this comes into play. There was a lot of comments on my previous post that there would have been clots, there would have been excessive bleeding. All of that was there. All the signs for placental abruption were there, even after she gave birth to the baby. So on the next video, we're going to go ahead and dive right in to this whole thing with the bleeding and everything else, and then just kind of continue her testimony from there.